Hi, I'm Dr. Eric Smith with RightSizeRightNow.com. Thanks for tuning into my presentation today called Selling Philosophy. And we're going to start off this presentation talking about the biggest or the single biggest reason why chiropractors fail or fail to excel in our profession. It's the fear of rejection. Keep in mind that the fear of rejection is just a human condition. It's an inborn fear. In actuality, it's really a survival skill that we fear rejection instinctually. And the key thing to understand about this fear is that it's actually the denial of the fear of rejection that winds up being remarkably self-destructive. So to illustrate this point, let's talk about the profession for a second. And before we get into that, I'm going to define a business term. The business term is USP, Unique Selling Proposition. So what can the consumer get from you and you alone? So let's go back to 1896 in Davenport, Iowa. D.D. Palmer had opened the Palmer School of Magnetic Cure, and in the early days of chiropractic, D.D.'s diploma granted the right to practice as well as teach chiropractic. Early students and teachers of chiropractic were often osteopaths, medical doctors, as well as a lot of different eclectic natural healers. Now, teaching chiropractic was a business, and a potentially profitable one. And where there's profit, there's competition. So schools proliferated, and some chiropractors even started apprentice programs to graduate chiropractors. As chiropractors in their schools increased in number, they differentiated into two distinct, unique selling propositions. The first was the Palmer USP, sort of the fountainhead of all things chiropractic. And what D.D. and later his son B.J. were is they were promoting themselves as the source. That is, that they were the only ones that were capable of teaching the Palmer system and qualifying Palmer chiropractors. As an aside, they were so successful with this that the Palmer USP was a big factor in school and patient choices well into the 1980s. Now, seeing that many of the early graduates had eclectic backgrounds in the healing arts, as they developed schools, they oftentimes developed schools that integrated disciplines in addition to chiropractic. So in other words, they became the mixers. So they were doing chiropractic in conjunction with other techniques or services or goods and promoted mixing as being the greatest benefit to the patient. So these two early schools have differentiated into two camps. The Palmers being the only, using the USP of, hey, we're Palmer, we're the best that chiropractic has to offer, and the mixing schools as basically having a different perspective that we're offering, more than Palmer. So the origin of our 119-year-old philosophical argument is really simple economic competition between the schools. So there's a challenge with this in the sense that, we have a lot of validation of chiropractic and the various modalities that chiropractors use, but there's never been a definitive study that really shows that one approach to a patient's health is superior to the other. So to compound things at this point in time, chiropractic was totally unregulated, it was ill-defined, and it was not licensed. Following D.D. Palmer's lead, chiropractors advertised and advocated that they could adjust the cause of all disease. And they tended to create a lot of sensation wherever they went. Around the country, there was a strong reaction from the medical community as well as the osteopathic community. And it's important to remember that osteopathy was founded in 1874 by Andrew Taylor Still, and that makes osteopathy 21 years older than chiropractic. Osteopaths had their own tussle with the medical community when they got started, and they made inroads to licensure and regulation, which was their way of providing protection from medical persecution. And by 1895, D.D. Palmer and other chiropractors were faced legal charges, that they were practicing medicine without a license or osteopathy without a license. And this brings us to one early trailblazer. He was a 1901 graduate of Palmer's. His name was Thomas Story. And in 1905, it came to the attention of D.D. Palmer that Story had been implicated in several deaths following his treatments, and he had actually fled the country to avoid charges being filed again, to avoid facing charges. When Story graduated from Palmer's program in 1901, Palmer had not actually started teaching cervical adjusting. So Story actually invented his own technique, sometimes involving suspending the patient and using a wooden chisel or mallet on the joints. This actually created a big sensation. He actually got press coverage in the Los Angeles Daily Times in 1905. So also in 1905, D.D. Palmer was actually called by two apprentice-trained chiropractors, Johnson and Whipple, in La Crosse, Wisconsin. And he was called, they had charges placed against them that they were practicing medicine and osteopathy without a license. And when Dede went to their offices, he actually inspected their procedures and found them to really be lacking in any kind of adherence to his teachings, because they were apprentice trained. They really didn't have anything to do with their education. They were doing alcohol massages, they were kneading bowels, they were applying batteries to injured joints and muscles. In other words, they were mixing. And this is really the time when Dede Palmer started fomenting the concept that mixing was something that was dangerous for the profession and was actually dangerous for our patients. So Dede agreed to help them, provided that they stop all the mixing. So Dede went to court for them, and his defense for them was basically to say, hey, I'm Dede Palmer, and I invented chiropractic. I'm the discoverer of chiropractic, so to speak, and chiropractic is different than osteopathy. It's different than with medicine because I say so. That ultimately was the extent of Dede Palmer's legal strategy when he went before court. Didn't work. Johnson and Whipple were found guilty. Okay, and then later on in 1905, Dede Palmer went on trial himself for practicing medicine and osteopathy without a license. Now, Dede's legal strategy here was the same, that he was simply saying that, chiropractic was a different and separate and distinct healing art defined by his research and his teaching. So the important thing to understand about this from a philosophical standpoint is that our straight versus mixer is, we've taken the fact that this debate or this controversy, divide in chiropractic, has been first developed by opposing USPs between schools, and now we're going to add to that mixers are now really being perceived by Palmer as being dangerous, and left unchecked could become a threat to a chiropractor's ability to practice. At this point in time enters the stage one of the great unsung rock stars of chiropractic, Shivataro Morikubo. Now, Shivataro Morikubo was a remarkable man. He spoke 3 different languages. He had a master's degree, a degree in osteopathy, a degree in chiropractic, obviously, as well as being a PhD. He was an elegant public speaker, and Morikubo really was perhaps the most educated and sophisticated chiropractor around. Now, B.J. Palmer and Morikubo spent much of 1906 fashioning a legal defense to challenge the Wisconsin law that had been used to prosecute Johnson and Whipple. When they were ready, they sent Morikubo to La Crosse, Wisconsin, where he rented office space from the same building as A.U. Joris D.O., a member of the Wisconsin Board of Medical Examiners. Now, this was the very doctor who had filed charges against Johnson and Whipple in the previous years. Now, B.J. and Morikubo deliberately provoked the confrontation, and they were prepared for the charges that Morikubo almost immediately faced, which, of course, were practicing osteopathy and medicine without a license. B.J. Palmer, Morikubo, and their legal defense, Tom Morris, mounted a successful legal defense that would be used over 3,000 times in the next 30 years and paved the way to licensure in all 50 states. Their defense was that chiropractic was a separate and distinct healing art, that chiropractic had its own philosophy, science, and art, and it was distinctly different from medicine or osteopathy. To quote Morikubo, it was not tactics, but the philosophical aspect of chiropractic in which we emphasized and laid stress upon that won this victory. That is, it was not the emphasis on the legal aspects, but rather the emphasis on the philosophy that won the case. And from that point forward in our history, Palmer emphasized chiropractic philosophy, of course with BJ being the fountainhead, as Palmer's USP. And the economic issues of the profession, the schools, the right to practice, had now firmly solidified into a philosophical argument over scope, and we've been having that argument since 1906. And that is this straight versus mixer. First of all, it starts off as simple economic competition between schools. Now, mixers are really a threat. They're being perceived as a threat to chiropractors' ability to practice. And you also have to say that mixers are thinking sort of the Palmer camp and the control the Palmers are trying to exert as being a threat over their ability to practice. But now philosophy, for the first time, is really coming up, and it's actually a legal defense that is actually paving the way for licensure. Now, my question to you is simply this. When we think of the infighting, the great divide as B.J. Palmer called it, when we think about the infighting between chiropractors, is this a philosophical issue or is it a money issue? I want you to entertain that question for a minute. But while you do so, can we agree that the infighting does not serve our profession or the patients we serve? So I think we can all agree on that we being a divided profession does not really serve anyone. If we're going to have this argument for 119 years, I think that's pretty dysfunctional. And oftentimes one of the things that I like to do is follow the money trail to kind of try and discover the root of dysfunction. If you look at the economic competition between the schools, that's really clearly a money issue. If we look at mixers being a threat to chiropractors' ability to practice, that's really their ability to make money. And now philosophy being a successful legal defense, paving the way for chiropractor licensure and the right to make what? Money. So ultimately, the great divide, straight versus mixer, this ongoing battle between the principled and the therapeutically oriented, I'd say it's pretty self-destructive to continue to have this argument for 119 years. But the reason we do so is that it actually solves a bigger problem for us within chiropractic. And that is simply the biggest single reason why chiropractors fail or fail to excel in our profession is the fear of rejection and ultimately the lack of emotional management skills. Now, why is this important? Why do we hold on to this argument for 119 years? And why do we deny our fear of rejection? Because remember, it's the denial of that dynamic that is remarkably self-destructive. And ultimately, in chiropractic practice, you have to sell chiropractic. That's what it comes down to. And whenever you have to sell something, all sales require a confrontation between you and the consumer. The result of that confrontation is going to be the acceptance or rejection of your goods, products, and services. And most chiropractors fail because they take this rejection personally. Think about it this way. You're a chiropractor. You've spent, your whole educational process. You've gone through an associate position, or maybe you've gone straight into practice. You have this beautiful thing, chiropractic, and it's your way of supporting yourself, supporting your family. Hopefully it's a profession that you love and love to be in, and you come and you show it to the new patient. It's like, here's this beautiful pure pearl I had to show you, this thing I love, and don't you want that because it can help you? And the patient goes, no, I need to go talk about this with my wife. Or, no, I just want you to crack my back. I don't want to do a care program. Or you get the EOB from the insurance company and they've taken your $50 office visit and they've reduced it down to $12. Okay? So it's really hard not to take that rejection personally. But the reality of it is that this rejection is something that you have to learn to process. So we need to learn emotional management skills. And rejection is a pretty negative emotion. And human beings are so really poor at managing our own emotional responses. We're actually so inadequate at emotional management and response that we oftentimes resort to fantasy, denial, emotional suppression, even addictive behaviors, all to avoid having negative feelings. So let's bring it back. The primary reason why the public rejects chiropractic is not chiropractic. The primary reason why the public rejects chiropractic is money. And it really has always been money. So we're going to pause the presentation right now. This is about halfway through the presentation. I'll have the next part within about a week. And thank you for tuning in so far. I hope this has piqued your interest, because what we're going to talk about in the next section is really what this does to us on a personal level in our practices, and more importantly, offer you some solutions about how you can learn different emotional management skills and techniques to deal with the fear of rejection in a real-time situation, what I call right now, and keep your practice and keep your emotional responses in the right size. That's where we get the name Right Size Right Now. So thanks for tuning in, and I will talk to you next time. Thanks.